So today I'd like to talk about a topic that has recently gained more attention nationally and in the news with the recent Adderall shortage that many people are experiencing and many pharmacies are having to deal with across the country, and that is an increase in ADHD medication prescriptions, especially during the COVID pandemic. So ADHD stands for Attention Deficit Hyperactivity Disorder, and it is a neurodevelopmental disorder that affects individuals' ability to pay attention, to control their impulse behaviors, and regulate their level of activity. It is estimated that approximately 5 to 10% of children and 2 to 5% of adults are affected by ADHD worldwide. So the COVID pandemic and lockdown brought a lot of disruption to people's daily lives and their day-to-day routines. Individuals, especially children, felt these disruptions in their school and their social lives. The sudden transition from in-class school to online school and a new lack of structure for their day-to-day lives led to many children facing many challenges, especially those with ADHD. The move to remote learning, reduced face-to-face interaction, and lack of physical activity due to lockdowns led many children to feel that they had a decreased ability to pay attention and to control impulse behaviors. The pandemic also brought about a heightened sense of stress and anxiety for people of all ages. Fear of the virus, self-isolation, financial troubles, and uncertainty about the future took a toll on the mental well-being of people of all ages. This heightened level of stress and anxiety can exacerbate ADHD symptoms and cause individuals to have a harder time coping with their condition. It is likely due to these stressors and anxiety and lack of routine that led certain individuals with ADHD who previously felt that they could handle their condition without medication to now reach out to a healthcare provider and ask for a prescription to help dealing with their worsening symptoms. The COVID pandemic also brought about a shift towards telemedicine and other online health services. And these were a lot easier to access for a lot of people. The convenience of virtual appointments broke down the barriers of access for a lot of people and helped people talk to healthcare providers about their symptoms, maybe for the first time. It is through this ease of access and accessibility that many people were likely diagnosed with ADHD for the first time through telemedicine, which would increase the amount of prescriptions during the COVID pandemic. And then there was a study done in March of this year by the CDC that went over the sharp increase in ADHD medication prescriptions during the pandemic. So here they have it set up for female and for male, and for 4 separate age groups, which aren't so important, but you can see the sharp increase in 2020 to 2021, and these sharp increases in the annual percent change in the percentage of people. So eventually what they concluded is that females of all age between 2016 and 2020, the average annual percent change was 3%. And as of 2020 to 2021, the change went all the way up to 13.9%. And for males, that same 2016 to 2020 period had an average annual percent change of 0.9%, and during the pandemic rose to 5%. So these statistics just highlight the significant increase that people of all ages and genders, the increase in ADHD medication that they experienced during the pandemic. So inclusion, the increase of stress and the increase of anxiety and fears, the change of routines, brought about many people's need to speak with a professional, and with telemedicine, that became a lot easier for many people, and they were able to get diagnoses and receive prescriptions that they felt they needed. And all those factors led to an increase of ADHD medication prescriptions during the COVID pandemic. Okay.